When a medical student enters medical college, they're not really taught on how to talk to patients or relatives. I know this because I went through it. It wasn't until I prepared for my MRCP exam, which is the UK equivalent of MD medicine, that I finally went through a process where I was judged on my communication. So in that exam, if a patient were to suggest that they were uncomfortable with me, the examiners would fail me. And that got me thinking about why don't we in India focus on this more? Because over the years, I have understood that as a doctor talking to a patient, it's not just academic knowledge or how quickly I can diagnose a patient that is important. There are other things that decide whether I am a good doctor or not. So in today's video, I'm going to share with you 5 things that I believe can turn a doctor into an even better doctor. For those of you who are new here, I'm Dr. Siddharth Warrior. I'm a neurologist and welcome to my YouTube channel where we talk about neuroscience, health, and all the things that can make your life better. If you haven't subscribed yet, consider doing so. It means a lot to me and you will get to see high quality videos on your health on your timeline. Now, the first characteristic of a good doctor is humility. Now, doctors can sometimes have a God complex, and I can understand why. They are in a situation where they're sitting in the OPD, hundreds of patients are coming to them asking for help, and they are actually able to help them. And patients are grateful, they come back and express that gratitude in different ways. Especially in India, there are patients who call doctors as gods and treat them that way. But if anything, this makes it even more important for doctors to always remain humble, whether you're talking to patients, your juniors, or to other doctors. We should never forget that it's not really about us, it is all about what is good for the patient. The second characteristic is good communication. Now, doctors have a tough job because they have to communicate some of the most difficult news, which is about someone's health, to somebody who is already in a very emotional state of mind. It is unlike any other social situation because there is so much of raw emotion constantly. Now, it is unfortunate that at least in India, all of the focus on medical education is on diagnosis and treatment, and there is very little attention paid on communication. Every doctor has to learn how to communicate by themselves, and since every person is different, every doctor communicates differently. So skills like how to use voice modulation, how to pick up facial expressions, how to use humor to make a patient more comfortable. All of these skills are learned by different doctors in different ways. And you will notice that some of the best or most popular doctors are the ones who have cracked this code. Eventually, all doctors figure it out. But if you're a medical student and you give this importance, trust me, patients will value this. The third important characteristic is updating knowledge. Yes, you've gone through several years of medical college learning about medicine, but this is a field that is constantly evolving, and every couple of years, everything that you know about a topic might change. It is so important to keep yourself updated, attend conferences, read the latest books, and keep yourself updated on all the research that is coming out. Staying sharp and updated means you're better equipped to treat the patient in the best possible way as per global standards. And an important aspect of this is self-audit, which means you need to know where you went wrong, what you did right, and how can you improve yourself the next time such a case comes to you. The fourth thing that doctors should do is to take care of their mental health. Like I mentioned, being a doctor is a very stressful job, and many doctors don't really take their own mental health seriously. But it's also true that a calm and focused doctor is better for a patient than someone who is stressed out about a lot of things going on. So if you are a doctor or someone in your family is a doctor, I hope that you take out time, speak to a mental health professional if something is bothering you, have non-medical friends to talk about something other than medicine. Take out time for your hobby, take out time for your physical health, and make sure that you're not ignoring any warning signs. Because famously, doctors might be very good at treating others, but very bad when it comes to taking care of themselves. And finally, the fifth characteristic that makes a good doctor is acknowledging the team. Doctors don't work alone. Even if the system can sometimes make you feel like you're on your own, you are actually surrounded by a team that is there to support you. Whether it's nurses, junior doctors, and other colleagues, don't hesitate to seek help. In case you're struggling with a patient, never hesitate to ask for a second opinion. Ask your colleagues to look at the case. Very often, having a fresh pair of eyes look at the problem can help you solve it. We should never let our own ego or biases come in the way of a patient getting better. I do believe that a doctor's job is one of the more noble ones, and we do make a genuine difference in people's lives, but it is also a job that requires dedication, knowledge, and a lot of empathy. This video is meant for both doctors who are already practicing or for students thinking of joining medicine as a career in the future. The world of medicine is challenging, it is rewarding, and it helps you connect with people in a way that other jobs don't. I wish you guys all the best, and I'll see you in the next video. Bye everyone, take care.